Hey, what is this? Well, let's talk about it.
This is a pulse oximeter. Pulse oximeters have two numbers on them, the top one being your oxygen saturation and then the bottom being your pulse. Pulse oximeters come in many different variations, but they all serve the main goal of telling you your oxygen saturation and your pulse. Your oxygen saturation is just essentially how much oxygen you have in your blood. When you breathe in, oxygen enters your lungs and then moves into your bloodstream. From there, your bloodstream carries this oxygenated blood to your cells so they can produce energy. Once the cells use the oxygen, they produce carbon dioxide, or deoxygenated blood, which gets carried back up to your lungs and is breathed out. This is a really good image that shows how oxygenated blood and deoxygenated blood are circulated through your heart, lungs, and distributed to the rest of your body. Your body relies on a certain amount of oxygen to work correctly. When these levels drop too low, it can cause serious health complications. Oxygen is measured in percentages. An expected level would be 95 to 100%. However, some patients, like those with COPD, may have a different expected range. Those with COPD have a typical oxygen saturation level of 88% to 92%. So it's important to note that levels can vary from person to person. What happens if your oxygen levels drop out of these ranges? Low oxygen saturation levels are referred to as hypoxemia. Hypoxemia is typically treated with supplemental oxygen. This can include things like a nasal cannula, a simple face mask, and a non-rebreather mask. A nasal cannula may be used for mild cases of hypoxemia, while a non-rebreather mask would be used for more severe cases. Also, fun fact, you can have too much oxygen in your blood. This is called oxygen toxicity, and that's why it's so important to monitor oxygen levels while using supplemental oxygen. Pulse oximeters are typically placed on the fingers, but what happens if the fingers are not available? Well, pulse oximeters can be placed on the earlobe and on the toes. Other alternatives also include the forehead and palms and wrists. So how does the pulse oximeter really calculate all these levels?
The device works by shining red and infrared light through your finger to a sensor on the other side.
Oxygen-rich and oxygen-poor blood absorb the light differently, and the device uses these differences to calculate your oxygen saturation levels. Because of the way pulse oximeters use infrared light, it is important to note that some factors can affect the results.
Dark nail polish, long nails, a darker skin complexion, excessive movement, cold fingers, fire smoke inhalation, and tobacco use can all contribute to an inaccurate reading.
So next time you see one of these, you'll know exactly what it's for and how it works.